I meet people every day coming into our practice asking for consultations with Dr. Roy. I would say the majority of them are women, about 80%. So I guess I'm in the minority, but since I work in the industry, I feel like it's time to walk the talk, to address some of the things I see when I look in the mirror. One of the most surprising things that most of our patients see, and it happened to me too, is I had my picture taken side view, and I thought, wow, that's not who I feel like. Looked at that, I thought, I see so much like kind of loss of definition along my jawline, a lot of additional laxity in my neck. So those are the two primary things I'd like to address during my procedure, which is coming up in about a week or so. The question is, how did I come to the conclusion that now is the right time to do a surgical procedure? You know, it's kind of a confluence of all kinds of factors. I see wonderful results in the practice. I talk to people every day that are so happy that they made the decision. But for me, it kind of came down to continually looking in the mirror and realizing, like, that's not the guy who I feel like. You hear that from women all the time, but I think it's kind of a secret that men have those same feelings. So I just concluded, like, opportunity presents, and let's go for it.
I'd like to show some of the incisional markings that we do for facelifting procedures. This is for both the mini lift and for the lower facelift. There are some slight variations in men and women. That being said, in this case, because of the access that we have to a hair removal laser, we will actually be doing the more commonly performed incisions on him.
Well, it's pre-op day, and Dr. Roy is having Liz and me do our photography, right?
Yeah.
So what do you want me to do, Liz?
Okay, so first of all, I want you to take off your mask.
Thank you. Oh my God, I've been looking forward to that. Okay.
All right, so if you can just go ahead and put your shoulders up, look straight into the camera. There's going to be a very bright flash. Okay, so in 1, 2, 3, flash.
What am I expecting to both prepare for the surgery and after the surgery? So in preparation, I've had to give alcohol for 2 weeks. Dr. Roy said just in the interest of trying to minimize the possibility that I would have any excessive bruising or swelling or a phenomenon they call hematoma. I've been encouraged to limit down to 0 alcohol consumption for 2 weeks prior to the surgery. I've been using Elastin skincare products to prepare the skin for the trauma of surgery. Hi, this is Eric, and I'm here at Kaiser this morning to get my pre-surgical checkup. Dr. Roy has asked me to get an EKG prior to my lower facelift. So I'm here this morning to do that and to just do my general annual physical. Prepare my skin for the final time. I've been using for the last 2 weeks this product. It's called Elastin Skin Nectar. It has a trihex formulation, which basically speeds healing of your skin after surgery. So I'm going to go ahead and I'm just applying it particularly generously to the areas where I know Dr. Roy will be making incisions. In other words, around the backs of my ear, in front of my ear, and a small part right under my chin. So I'm here with my surgeon. so I'm not nervous at all.
It's 5
This guy
o'clock,
is gonna watch
end of
out.
the day. We're all cool, collected like cucumbers.
That's right.
Is that even an expression? I don't know, but
It is cool as cucumber, and I'm ready. Yes.
this is going to be really exciting. The whole office is here in support of Eric. We're really excited.
Looking forward to it.
My goodness. So tomorrow we'll record a little bit more on
Yes, we will.
the morning of, and then we'll be gone for a few hours, and then
we'll be back on.
we'll be back on, and hopefully Eric is going to recover well tonight.
Yep.
Or sleep well tonight. No
Easy
drinking.
night.
I get to drink a glass of wine. He doesn't.
Only one for you.
Only one for me. And then early bedtimes for both of us.
Early bedtime. I'll be there at 7:30. See you, Doc.
Perfect.
Okay.
See you guys.
Bye.
All right, we're in the operating room, and Mr. Kies just walked in.
Oh,
Say hello to everybody.
Hi, everybody.
Good hands. Here we are in our state-of-the-art physical center. Say hi to Ashley here. And say hi to May. We're all going to get set up here. And hopefully soon we'll be able to videotape some of the procedural elements of the case. But we're really excited. We're going to give Eric a little bit of privacy now as he goes to sleep. Pick out a great dream. All right, guys. We are done. Eric did amazingly, being wheeled out into recovery. He's got his compression dressing on. And we're just going to wait for him to wake up a little bit so he can share how he's feeling. Anyways, everything went really good. Thanks for joining us. And we're excited to show you what his after is going to look like. All right, take care.
It's been a week after my facelift. This certainly has been convenient for the first few days to hide a little bit of the minimal bruising I had on Thursday, Friday, Saturday of last week. But most of that's resolved. I'm going to show you what's going on. We're 7 days post facelift. Let me take this all the way off. You still see I have a little bruising, a little swelling still under my jawline. But pretty much things are all resolved here on my upper face. I still have my sutures in my eyelids where I had my upper bleph. Still see how sutures are healing on the side view from there. So that's this is a facelift 7 days out. So this is what I think most people should expect. I was able to do some work in the yard and walk my dog. So this has been a lot easier than I ever thought. Thanks to Dr. Roy and everybody, his nursing staff. I feel like it was a very easy recovery. So I know a question that a lot of people have is like, how did I feel the day after my surgery? My surgery was last Wednesday. Today we're a week later, but I recall I had a little discomfort on Thursday and Friday. I also felt a little hazy just from, I think, the effect of the anesthesia. I did come to work for a part day on both Thursday and Friday. Took it easy while I was here. I had a little bit of achy pain, is how I would describe it, on Thursday and Friday, particularly from the area behind my ear where some of the tissue is suspended. By Saturday morning, I did not need any more oral medication, any more oral painkillers. So I was just taking a little Tylenol on Saturday and Sunday. I was up doing regular yard work in my yard, and I was cleaning my skylights and cleaning my solar panel on those days. So life got back to normal for me pretty easily. I had minimal swelling in the lower face, which now is all kind of settled in underneath my jawline. I definitely feel puffy under my jaw and a little bruisey, but overall I'm like back to work, like 100% here as of Monday and Tuesday. Hey you all, it's about 10 days post facelift. I wanted to share my results so far. I'm going to take my mask off here so I can show you what's happening. I'm really pleased with my results. I have probably seen them on some of the sliders or swipes on Dr. Roy's Instagram page, but this has been a very easy recovery for me. I did a upper eyelid surgery, so blepharoplasty, as well as a lot of work here down on my neck section. So things looking good. I'm feeling a little bit woody, a little stiff right here under my chin, but that's the only residual kind of effect I still have. Dr. Roy tells me it's going to be maybe another week and a half to 2 weeks till some of this kind of swelling underneath my chin resolves. But all in all, I think I'm looking pretty good. Hey, we're going to give you a little around the world here. Here's that's how the neck and lower face came out. Really pleased. Hi, it's Eric, and I just wanted to share with you my 20-day post-surgery view. I did my facelift and my upper blepharoplasty with Dr. Roy. It was 20 days ago, and here's the results. So things are looking pretty good. I'm really pleased. Significant improvement in my neck, as well as my lower face and my jawline. I still have a little swelling down here, which Dr. Roy tells me is normal. I'm probably going to have that for another couple weeks. A little bit of stiffness under the ears as well. But you should take a look at these incisions. They're really carefully crafted. I'm not sure if it's focusing, but the area behind the ear and in front of the ear looks really clean. So overall, I am just thrilled, and I feel like this made a big improvement for me. Thank you.